It's not pretty, but it could be helpful. For more than a year, Dalhousie University researchers have been testing wastewater for COVID at Halifax's main plants, but also at localized sites, such as on campus, by dropping this ball down the sewer.
Water in the sewer will continually go by this filter paper, and then after 24 hours, we pull the device out and extract whatever's been accumulated on this filter paper.
Yes, that means they're studying what you flush. And some researchers say the surge in Omicron cases makes it more important than ever.
We're starting to see challenges to management by things like limited PCR testing and clinical testing. Then the potential for its use is much more obvious.
But the testing is not standardized, and how provinces are using it is all over the map. Ontario has a coordinated wastewater surveillance network that covers 75% of the province's population.
It's not going to give you accuracy to the number, but it will tell you that, maybe we have 30,000 cases in Ontario rather than 13,000.
He says right now, wastewater testing could actually provide a better picture of how much COVID is in our communities. But Nova Scotia's Chief Medical Officer of Health disagrees.
We continue to have conversations with the researchers, but there's a lot of questions. And from a public health perspective, we don't feel that it's yet at a point where we can accurately use it as a surveillance tool.
Conant says analyzing wastewater has been done before, mostly in Europe, to look for polio. She says it should be used to augment other practices, not replace them. Back at Dalhousie, Gagnon agrees.
You might see it as a smoke over the hills.
One more tool at a time when clinical testing is just overwhelmed. Kayla Hounsell, CBC News, Halifax.